So next up, next speaker is Tanya. So Tanya is a PhD student from the University of Oxford, and she specializes in child and adolescent psychiatry. And the floor is yours. Welcome.
Hi, everybody. I am so excited to be able to present my research to you all, and I'm very grateful for this opportunity. So I'm a second-year PhD student. Thank you so much for the introduction. So we're going to get right into it. I'm going to shift gears a little here and switch over to the psychological side of things. I'm going to be presenting on adolescent mental health, specifically talking about the role of friendship interventions on the mental health of adolescents. So to begin, adolescence is a key developmental period, and actually one of the longest developmental windows. It exists between the age of 10 to 24 years, instead of 10 to 18 years, like was previously thought. And this is based on some newer research by Sawyer and colleagues published in The Lancet in 2018, who argue that biological markers such as earlier puberty and changes in social role transitions, such as further education and later marriage, constitute an expanded and more inclusive definition of adolescence. Adolescence is also a period of rapid neurobiological change, social identity formation, and social brain development. The physical, emotional, and social changes that adolescents go through can make them more vulnerable to mental health problems. For example, the limbic system, responsible for regulating emotion and motivation, undergoes significant changes during adolescence, which can lead to increased emotional reactivity and mood swings. Increased risk-taking, independence from family, social stress, and pressure are just some of the other factors that can contribute to adolescent depression. The World Health Organization reports that suicide is one of the leading causes of death for young people aged 15 to 29. Now moving on to friendships. Friendships, which are usually mutually beneficial relationships that individuals voluntarily engage in, play an enormous role in the lives of adolescents. They can contribute to adolescents' peer affiliation, their concept of self, and their general well-being. Friends during adolescence even surpass parents and family as the primary role of social support, and feeling connected to peers becomes more important than ever. So this figure over here is from a 2021 cross-sectional survey of 10,527 adolescents in England. And it revealed that most young people report having had a mental health problem. In fact, after the age of 13, the percentage of adolescents who reported having had a mental health problem were 50% or more. So when so many young people are struggling with their mental health, I suppose the question we want to ask is, who are they turning to, and how are adolescents reaching out for support? Past research shows that adolescents reach out to their friends most often for support. For example, the figure that you see here is from a recently published paper by my colleagues. They analyzed data from 12 to 18-year-old students and found that friends were the most common source of support sought for self-harm. However, when adolescents were asked to report on the helpfulness of the support, less than half of adolescents reported that the support was actually helpful. This suggests that adolescents may not have the right tools they need to help a friend in need of mental health support. And so it's important to figure out how we can improve this perceived helpfulness of informal support from friends. While peer support interventions have been implemented in the past, which consist of organized support from other adolescents who've experienced similar mental health problems, leveraging adolescents' authentic social groups as sources of informal mental health support can allow a more significant portion of adolescents to receive support for their mental health. Friendship interventions are one way to potentially improve the helpfulness of informal support from friends. However, interventions involving an adolescent's authentic social group are rare in evaluation and implementation, despite friends being the first and most common source of support sought by adolescents. Our study employed a scoping review and systematic approach to map the breadth and evaluate the efficacy of friendship interventions for adolescents that involve their authentic social group, which we defined as the voluntary social relations with mutual benefits that adolescents engage in as part of their peer affiliation. Our population of interest were adolescents between the ages of 12 to 24, or those in secondary school and further education. We searched across 6 databases and screened 37,585 articles. So you can tell that the screening process was quite intense, out of which 24 were included in the scoping review and 18 were included in the systematic review. So what did we find? Well, data was analyzed from 12,815 adolescents that were included in the identified studies, and we used a descriptive analysis to identify themes. We found that most studies took place in English-speaking countries, surprise, surprise, with the majority taking place in Australia. 3 prominent themes emerged. The first was promoting mental health literacy. So a bunch of the studies worked on promoting mental health literacy across adolescents. The second was supporting help seeking. So that's encouraging adolescents to seek help for themselves and for others. And the third was friendship building and combating isolation, so combating social isolation. General mental health and well-being interventions were the most popular among the studies we evaluated, and all studies reported better mental health outcomes and literacy among friends who were trained in the intervention. So that refers to the adolescents that the intervention was delivered to. Information about the potential friends who actually received the support from their trained friends was inferred because it wasn't directly provided for most of the interventions. So, for example, the friends who received the interventions later self-reported using their new skills to help a friend in need, but only 2 of the interventions that we included actually measured the helpfulness of the support received by the friend in need. So, here, we mapped out the targets of the included friendship interventions in both the scoping and the systematic review. So as you can see, general mental health and well-being was, common throughout all of the interventions. And then we had some on reducing self-harm and some on friendship building. Improving help seeking was also another big target. But then we really only had 1 or 2 on eating disorders, male mental health, substance misuse like alcohol misuse and cannabis misuse, and providing direct support. So providing direct support referred to the 2 studies that actually recruited friends, like best friends, and measured the support that they provided. We identified many gaps through our review. Specifically, we found that the direct impacts of the intervention on the friend receiving the support were not measured. There was also no identification on the different types of friendships which may exist, such as social media or online friends, despite research suggesting that social media and other virtual platforms, like gaming platforms, can serve as beneficial for adolescent friendships. The active ingredients of mental health treatment, such as behavioral activation, which has been shown to improve depression amongst individuals by increasing engagement with positive activities, for example, was also not discussed in these studies. Neither was social inclusion or bullying, self-evaluation, or trauma and grief-related support, despite research suggesting that adolescents turn to their friends often for emotional support following a traumatic event in their life. The interventions also mostly focused on self-help or improving mental health literacy. The focus was rarely concentrated on solely providing support to friends, as this was often a secondary or tertiary outcome. Next, as long-term outcomes of the intervention were not evaluated, it's really unclear whether booster doses of the intervention are needed periodically to revive adolescents' knowledge and ability to provide helpful support to their friends. Another notable limitation was the delivery of the intervention programs. Some interventions used trained staff to disseminate the program, where others used trained teachers in a school, and some recruited youth volunteers with lived experience of mental illness. This may have led to some biases in intervention presentation, as some trained leaders may have had some pre-existing relationship with the students, for example, teachers. And now this slide over here, this is an overview of the implementation and the results of the studies that we evaluated in the systematic review. So to begin with, the participants in the studies that we evaluated in our systematic review were either recruited from schools, universities or colleges, or their community. The intervention was delivered to these adolescents through either an entirely remote-based training, which was usually self-directed, either entirely in person, or a combination of remote and in person. And the in-person training was facilitated by a teacher, trained staff, or a professional like a psychologist. And then there were really two groups of outcomes that the studies focused on. So the first one was obviously the measured outcome of the intervention on the friend who was being trained in the intervention. And then the second group of outcomes were the inferred outcomes of the intervention on the friend who received the support on the other end. So the adolescent who was trained in the intervention had increased confidence to provide support, had increased mental health literacy, and also knew how and where to seek help for themselves and their friends. And then for the inferred outcomes of the interventions on the friends who were supposedly helped, there were three ways in which they were impacted. So the friend who was trained would either directly provide support to the friend who needed the support. The friend who was trained would encourage the friend who needed the support to seek support from a professional or an adult. Or the friend who was trained would reach out directly to the professional and the adult and then get them to help out their friend in need. So most of the included papers work to improve mental health literacy amongst adolescents to equip adolescents to better support themselves and their friends. The included interventions work to either improve social support, teach individuals about the signs of mental illness in their friend, or improve confidence to support a friend. Help-seeking attitude improvement was also a notable theme. The interventions we evaluated also mainly focused on friends being trained in the intervention and their outcomes, and there was little to no focus on underprivileged adolescent populations or adolescents with high adverse childhood experiences, which would include individuals who may have reduced access to professional resources and may benefit most from informal support from a friend. Overall, we conclude that friends are seldom involved in mental health interventions, despite being a key source of informal support for adolescents, especially in times of crisis. Future research should focus on addressing the gaps that are found in these studies and on the development and implementation of an intervention involving an adolescent's authentic social group and determining how they affect the friend who's actually being offered the support. So in terms of future directions, now that we know what exists in the literature, we can focus on addressing gaps and understanding the relationship between friendships and mental health in more detail. For example, I'm currently doing some data analysis using a 2021 cross-sectional survey of adolescents in England, and what I've found is that girls, more than boys, report turning to their friends for mental health support. So exploring the gender-based determinants of seeking mental health support from friends may be important to understand where and how to implement future friendship interventions. Another way to help develop effective friendship interventions is to understand how friendship dynamics during adolescence have changed. For example, understanding the link between friendship quality and mental health outcomes can help us determine if interventions which help increase friendship closeness would be more promising. So in this analysis, I found that individuals who scored higher on the total anxiety and depression scale also reported as having poorer friendship quality and not getting along with their friends. And lastly, another way in which we can develop better friendship interventions is just really understanding the role of online friends and how they compare against in-person friends. And this is especially prevalent now because ever since the COVID-19 pandemic, adolescents are engaging more online with their friends, and they have friends that they've never met in person, but they know online. So really understanding the link between that would be super helpful for the future. So what are some key takeaways? Well, developmental changes during adolescence puts young people at a higher risk of developing mental illness. Friends are a key component of adolescent development and can also serve as informal support sources for adolescents that are showing signs of mental illness. Improving mental health literacy is a common theme that's found in current friendship interventions. And friendship interventions do show potential for the mental health of adolescents, but are severely underexplored. Addressing gaps in the literature and understanding friendship dynamics better is crucial to helping develop successful interventions, which can ultimately contribute to better mental health outcomes for adolescents. The importance of friends for many adolescents and the support they provide to each other during adolescent development is indisputable. Friendship interventions have the potential to improve and protect adolescent mental health. They can be implemented in a natural setting, using the adolescent's pre-existing social circle as a source of informal support. The results from our study highlight how little is known about this important potential area of mental health interventions, and developing a multifaceted lens of inquiry into which supports might be best delivered by which friends might enable more adolescents to access support in their times of need. By studying friendship interventions, researchers can learn more about the mechanisms behind these effects and develop effective ways to promote social connections and overall improve mental health outcomes. Thank you.
Thank you very much. So let's head toward the Q&A session. So, yep, please ask away any questions. Don't be shy. Yep.
Hello. Hi, Ms. Manchanda. That was an excellent presentation. I really enjoyed it. When you were looking across studies in your review, did you see any methods that were particularly effective or common in the literature?
Yes, we did. So we found that a bunch of the reviews included simulations or role plays and getting the adolescents involved during training by doing a role play or by simulating an actual event or simulating an actual friend in need through vignettes, for example. That seemed to be most effective, and the interventions that included that tended to have positive results.
Thank you.
Yeah, terrific talk. Thank you very much.
Thank you.
I have a question because I think I saw on one of your slides that there are 38% that do not report that they have depression or like any other mental well-being. Do you have any idea how these kids could be addressed or like, yeah?
Yeah, so are you referring to one of the bar graphs that I showed where 38% reported not seeking help for their mental health at all, right? Yeah.
Exactly.
Yeah, so we do find that, you know, a large majority of students, obviously, they don't reach out anywhere for support. And I think the way that this can be addressed is in schools, you know, really making sure that there are people available to help support individuals, or that individuals feel safe reaching out. I think that's super important. Making sure that there's like a comfortable environment. And then also, I think early intervention in some way can also help. So, for example, you know, maybe teaching parents to tell their kids about the importance of reaching out to their friends, reaching out to other adults at a young age. I think that's very important. During adolescence, it's much harder to get that message across. But when kids are younger, you know, if we really have like early intervention, by the time that they're in, you know, they're a teenager and they're going through these sort of mental health difficulties, they might feel more comfortable reaching out to a friend.
Perfect. Thank you.
Right, over there.
Okay, thank you for the presentation. I'm Jinanus from Hong Kong. My question is that you did the analysis of systematic review by including all mental health illness problems. So have you did any subgroup analysis in terms of, because in the adolescent group, people have different severity, like different types of maybe depression, anxiety, bipolar, a lot of maybe there are more than 4,000 psychiatric disorders as far as I know. So have you did first in terms of difference in terms of disease pattern, as well as in terms of sex, as well as in terms of region, because cultural factors also may affect the level of people's relationship in terms of intimacy, trust, as well as communication among friends in order to overcome or in order to increase the applicability of the relationship between as an intervention. Thank you.
Yeah, so I think the first part of your question, does that ask why the systematic review wasn't kind of divided within subgroups of different mental health illnesses and stuff? Is that right?
Yeah.
Yeah, so that was because we had such a small amount of papers that were used. All these interventions are very novel. They're kind of used only once. And the differences that we had in terms of the mental health illnesses that they were targeting were very minute. I mean, all of them tried to target like general mental health literacy or general mental health illness in some way and promote general mental health literacy. But then some had like, you know, a few differences where they were like, oh, like a little bit more focus on eating disorders and then a little bit more focus on substance misuse. So it was, because of that, it was just really tough to do like a deeper analysis. And that's just because there aren't really many interventions on that. So this was kind of the first review of its kind. There are no reviews on friendship interventions as of yet. So this was the first review of its kind to even, you know, put the literature out there for, yeah, these are the interventions which exist. Yeah, so that's kind of why we weren't able to kind of divide it into subgroups.
Thank you.
There, yep.
Hi, fascinating stuff. I was just wondering, I'm not very familiar with this type of stuff. So how do you go from 18,000 papers down to 24?
Yeah, so we went from 38,000 papers
38,000,
down to
yeah.
24. Yeah, so what we did in order to in order to actually capture the interventions, which included friendships, we had to have broad search terms. So we searched across all peer group interventions, and peer interventions are very common. And also the terminology around friendship interventions is very convoluted in the literature. So some people say peers, but they're actually meaning friends. And then some people are saying peers and they actually mean peers that, you know, adolescents don't even know at all. So the process was very difficult. I mean, I spent probably months just screening through 38,000 articles, and then to only find, you know, a small amount, it was like picking needles in a haystack. But in order to actually find the interventions, we had to use broad search terms. The narrow search terms weren't producing any results, so yeah.
Impressive work. Thank you.
Thank you.
Yep.
Congratulations on the work. It's a mammoth effort.
Thanks.
My question's about how these interventions were actually measuring their effectiveness. In particular, as you mentioned, that most of them measure the effectiveness on the person who was delivering support to someone else, but only a couple for the person who received support. Can you comment on how they measured the effect in those cases where it was the person who received support?
Yes. So the way that they measured the effectiveness for the person who was receiving the support was through self-report questionnaires. So some of them kind of began by asking, by giving like adolescents a stress scale or an overall, you know, depression scale, and then also a scale that measures help seeking. And then they kind of took them through this intervention, and then they immediately after, they gave them the same scale to kind of see if their attitudes towards help seeking had changed. And then the interventions, which were supposed to improve social isolation, there was like a social isolation scale. So they kind of measured them right after the intervention, but then they tried to see if the results existed, you know, months after the intervention. Like I mentioned, the booster doses, like there was nothing about like, do we need booster doses for these interventions? Do adolescents even remember the fact that they've had this training, right? So the longest I found that the follow-up happened for was 12 months. And by that time, adolescents had actually forgotten. So though they'd retained some of the skills, they had forgotten some. They were still willing to seek help for themselves and others, but in terms of their mental health literacy, a lot of it had gone down. So yeah, I think one of the major flaws of all of these interventions that were included was the fact that I'm not sure if they're really scalable. Like, you know, there definitely needs to be like some sort of either booster dose or like it needs to be incorporated in the school curriculum as part of a course maybe, so that every year adolescents are getting kind of updated to kind of retain their knowledge. Yeah.
Thank you.
Hi, thank you for the great talk. I had a question about the Oxwell survey data, because I noticed that it said it was from 2021, which I would imagine is in the midst of COVID. How do you imagine that that changed how people interacted with their social support systems, particularly engaging with their friends? And did you look at any other data from other time periods?
Yeah, so the issue with the 2021 data is that it was right after kind of all the lockdowns had been lifted and everything. So we do imagine that there definitely are discrepancies in that data, but we have another survey coming out where we kind of, we have the same questions on that survey plus more friendship questions. And so future analysis is, the goal will be to kind of compare the two and see if there are any differences. Yeah.
Thank you.
Thank you.
So we have a few questions from the online side as well.
Okay.
One of them is sort of what could be the other factors that are mediating the relationship between friendship and sort of these interventions, such as, say, education or family. So I guess what they're asking is, what do you think are some of the more other variables behind sort of these ideas? So other than so I guess the emphasis here was friendship, but which we saw a certain amount of efficacy. But was there, in terms of the other types of help, were they better? Was there like support from family, even though teenagers don't like seeking them for support? So was there some differences in these?
Yeah, so I guess just to answer the question for the other factors that could have been mediating the relationship between friendship and mental health, I think education is definitely one of them. And I think, you know, being in a school where like friends are encouraged, where they have kind of more social activities, social programs going on. I think that can make a difference. I also think coming from a disadvantaged background can make a difference. You know, if adolescents are worrying about the fights that are happening on at home or like their circumstances in their house, they may not really have the time to make friends or be able to have those bonding opportunities where they can have their friends come over to their house or they can go over to their friend's house. So I definitely think that, you know, the background that adolescents are coming from is definitely one of the mediating factors, yeah.
And I guess the last online question we have is, has there been any studies on the differences in results between developed and developing countries? Often we think developing countries often have better suicide rates or less reduced suicide rates than the developed countries. It often comes quite as a surprise. So do you have sort of some comments in that area?
Yeah, so it's actually very interesting. Yeah, none of these have been done in developing countries. It's all been in English-speaking countries, with the majority happening in Australia. And obviously, like I mentioned earlier, you know, adolescents who have, you know, a higher amount of ACEs, adverse childhood experiences, or who come from countries where the suicide rates are higher or from backgrounds where it might be higher, I think it's really important to have these sort of informal sources of support there, just because, you know, they might lack access to professional support services, and then that kind of time that it takes for them to receive that professional support, which could be a very long time depending on where they're from. It's very important to have, you know, something to kind of intervene in the middle just to help them out, to help them go through it, you know, until they can actually access the support.
Absolutely.
Yeah.
We are unfortunately out of time, but that was a very nice presentation. Let's
Thank you.
so thank the speaker.
Thank you so much.